London, home to over 8 million people. When someone gets seriously hurt, it's down to the trauma doctors to investigate.
She's hit the headlights. I think it's probably going to be with the right side of her pelvis.
To save lives, they must look for clues.
The helmet is damaged, and that worries us about the impact to the head.
The trauma doctors have to assess the evidence within minutes.
So there's a dent here, but as to which bit of him hit that is not entirely clear, but quite possibly his head.
And unravel the medical mysteries.
There are a myriad of things that can cause all of those symptoms.
That police was asking me if this is still life-threatening, which it is.
In their search for answers, getting it right can mean the difference between life and death. As night falls over London, an elite squad of trauma doctors hits the road, taking their expertise out of the emergency department and onto the street. As they battle the traffic, it's a race against time to get to the patient. The quicker they get to them, the more lives they can save. Racing to a road traffic accident is trauma doctor Gareth Greer.
We're going to a motorcyclist who's been hit off their bike somewhere.
With accidents involving motorbikes, the trauma investigators will be looking for clues amongst the wreckage. Any damage to the helmet could be a sign of head injury. The distance of the body from the bike gives them a clue about the force of impact.
Red Base Delta Alpha 77 on scene.
Gareth now has just minutes to look for these and other clues. Every second could prove vital for the biker.
So where's your pain, sir?
In the leg.
All in the right leg?
Yeah.
How does your breathing feel?
Good.
So you remember exactly what happened?
I turned left of the lights.
You turned left of the lights? Yeah.
Oh, my leg.
Okay.
44-year-old Brian is a courier. He was on a job when the accident happened.
Do you think you hit your leg on something? Don't know. All right, I'll stop the questions and we'll get you out of pain, all right?
He's breathing away normally and talking to me, which is reassuring. He's in a lot of pain and the gas is helping him at the moment. This leg is really worrying me. His foot is very, very pale. I need to get this blood supply back.
I think our overall plan is some access, some ketamine and some splinting, but I'll work it through in a minute.
Yeah.
Do you have any other medical problems at all? All right, we get a drip in, strong painkillers, straighten this leg. That'll get you out of pain, sir, right? We'll get you out of pain completely. So as soon as this drip goes in, I'm going to give you something that's going to make you feel really sleepy.
Right.
Okay, you won't feel anything then.
Okay.
You'll probably wake up a bit in the hospital. Okay, but you won't mind that, yeah?
No.
Okay, all right. That shoulder sore there.
Yeah.
Yeah, I thought so. Well done.
Knee or your leg, or
That's the needle.
That's a perfect drip. I'm going to put a sedation in and then we'll be all sorted. And that'll take less than a minute to work, okay? Just rest yourself gently back. Just go back with your head. That's it. Well done. And just rest your head on the bike. That's it.
Now Brian's pain is under control. Gareth can check the scene for any clues that could point to other injuries.
Sometimes if the helmet is damaged, then that worries us about the impact to the head. But there's no damage to this helmet, so that's reassuring for me. This is a difficult one to work out. When the ambulance crew got there, he was underneath the bike. And so the position he's in now doesn't really represent the position he was in before. Because I think that right leg, the leg that's injured, must have hit this telephone box. That's brilliant. The sedation's working.
There are no signs of any other injuries. Now Gareth needs to concentrate on saving his leg.
There we are.
Brian's
That means
livelihood
sedate.
could depend on it.
Okay, so we'll just give it a nice little pull there. It'll crunch quite a bit, but you can't do any damage.
Yeah.
Do you mind just staying at the top end and just talking to him gently?
Yep.
Just so when he comes round, he's not too frightened, because he won't remember anything that happened.
77, go ahead.
This gentleman's GCS 15, but with a compound fracture to the right femur, which we've just manipulated. We're going to ground escort to the Royal London. Fairly pale, that foot, isn't it? I'm going to have a good look in the ambulance. Yeah, that's cool. The bottom of the leg here is quite vulnerable when you get an injury because the big artery called the femoral artery comes down the inside of the leg. And so if the bone around that breaks, then it can put that artery under a lot of pressure. The longer the blood supply to a limb is interrupted for, the more severe the injury to that limb is. So getting there and getting the blood supply restored to a limb like this is extremely important. The foot had started bleeding a bit, which does suggest that the blood supply is getting there, so that might be a good sign. But his foot still looks fairly white.
Brian is being taken to the Royal London Hospital in the heart of the East End. It's one of the world's leading trauma centres, and its emergency department treats up to 500 patients.
Okay, and they're going to be here pretty much any minute, probably.
So this gentleman's name is Brian. He came off his motorbike at a corner and hit his leg on a telephone box. When we got there, he was sitting up and talking GCS 15, no signs of any head injury, just pain in his right shoulder. But his major injury is a deformed and angulated right femur, which we've manipulated on scene. He had a cold, avascular right foot at the time, and the blood supply seems to have come back to that foot post-manipulation.
Okay.
Numbers-wise, he's been normal. He looks euvolemic. He's at a GCS of 15, but he's had 150 milligrams of ketamine, which he's now coming round for. He's at a total of 8 milligrams of morphine as well.
Okay, thanks very much.
It's now down to Simon to carry on the
so
investigation.
we're going to take the scoop out from the right with counter traction. It's just well...
Ready, brace, full.
Okay, let's crack on with the primary survey. There's a serious injury to his leg. It's pale. The blood flow is a concern, but I'm worried that there may be other serious injuries which aren't so obvious. Fracture of his pelvis, an abdominal injury, even a spinal injury.
Do you know where you are right now? Do you want to hazard a guess? Hospital, correct. And do you know why you came to hospital?
I'm in pain.
Because you're in pain.
What's your name?
Brian.
Good man, Brian. You stay still, I'm going to examine you, okay? Anything sort of just sing out for me, okay? All right, looking at your neck now, okay? Nice big breath in and out. And again, one more time. And out, well done. So pushing your chest now. Is that sore? Is that sore?
Don't nod your head, just say
Say
yes or no.
Yeah. Okay, good man.
The team search every part of Brian's body for any clues to other injuries.
Cool right foot.
Okay, so you're going to get line in, get some bloods off. We need to get the rest of his clothing off because I wanted to get some x-rays before we do anything else. Right, so chest x-ray, pelvis x-ray, femur x-ray, please.
CT angiogram, yeah?
Yeah, okay, we'll do. Blood flow into his leg is not normal. Well, I don't know whether the artery is being torn or whether it's being compressed or even pinched in between the fracture, or to see what the blood flow is like into that leg. Is there a Doppler around that we can use to have a look at his flow in his foot? His foot isn't a great colour and we can't feel pulse in it, so there's a major concern about whether there's adequate blood getting through below level of the fracture. Yeah, he could lose his leg if he's not got blood flow into that in the next few hours.
The trauma doctors at the Royal London Hospital and London's Air Ambulance are on call 24/7. Whether it's in the helicopter or the rapid response car, it's a race to get to patients and unravel the clues that could save lives.
1,000 metres, right-hand turn onto the A124. We're going to a female patient who apparently has been hit by a truck.
In these cases, the likelihood of serious injury is high. The patient's blood pressure and level of consciousness provide valuable evidence. Any damage to the vehicle increases the chance of internal bleeding, which could be fatal.
We've been running for about 30 minutes, trying to weave our way through the traffic. And this should be our road. Lights up ahead. Okay. All right. Okay. Red Base Delta Alpha 77 on scene. Hey guys, how are you?
Hi, sir. 19-year-old girl.
Okay.
Looks like what's happened is she's run across the road, striking this van. You can see the damage to the front there. The van was going about 30, 35 miles an hour. This car was stationary, so she bounced off of that.
Okay.
It's okay, I'll hold it.
Hello, sweetie. My name's Glenn. Just open your mouth up for me. Big R. Good on you. Still got your clothes on?
19-year-old care assistant Aisha was on her
What
way
we
home
might
from
do is
work
get you into
when
the back of the
accident
ambulance and
happened.
have a bit of a better look
Aisha's
at you,
father
hey?
has already arrived.
Just going to push on your chest here, sweetie. Any problems with that? Did you bang your head? You got a couple of cuts and bruises on your face, hey? Looking at what damage there's been to the front of that van, I'm concerned that she may have a fracture to her pelvis. I'm also worried that she may have some fractured ribs. And just underlying on that right side is a liver. She may have some bleeding. I want to have a good look at her. Okay. Do you mind if we get her in the back of the ambulance and we'll just get her clothes off and keep her warm? Yeah, that's lovely. All right. Thanks, guys. Excellent work. All right.
Glenn needs to find out whether or not the car ran over Aisha. If it did, it could make a huge difference to her injuries.
So she's sitting underneath of your car, has she? She can get herself up at all? You haven't gone over the top. All right. No problems. Thanks very much for that. All right. So she's run out and she's hit the headlights. I think it's probably going to be with the right side of her pelvis. There's a little bit of blood on the ground. She's also gone underneath this car here, which was stationary. Injury-wise, I think she's potentially got a fracture to the wing of her pelvis. Certainly got some knee pain. She's got a laceration over her face, but her chest, her abdomen, and the rest of her long limbs are unremarkable at this point in time. Hello there, you're Aisha's dad, are you?
Yes.
You're probably going to be okay to come with us in the front of the ambulance, and she'll go to Royal London. Okay.
With a possible fracture to her pelvis, Aisha could be bleeding into her abdomen. The only way they'll know is to do a CT scan at the hospital.
Royal London, Amy. Okay. Train by land, yeah? And vitals are stable. Okay, lovely. We'll see you in 10. The leg that's injured must have hit this telephone box. That'll get you out of pain, sir, right?
The foot is very, very pale, and I'm really worried about the blood supply. He's at risk of losing this leg.
Okay.
It's
BP,
almost
we haven't
an
got a blood
hour
pressure
since
come up on that.
44-year-old bike courier
Yeah.
Brian came off his motorbike. Time is running out if the trauma team are to save his leg.
Okay, so his pelvis X-ray looks fine, his chest X-ray looks fine. My only concern is about the leg.
No. Can't feel anything on the... Can you feel you being touched on the right foot?
No.
No. Okay. How about now?
There's something on my toes,
Yeah.
my left leg.
How about on the right leg?
No.
He could lose his leg if he's not got blood flow into that in the next few hours. The clock's ticking and we've got to find out if that blood flow is adequate or not, and if it's not, restore it before the damage is irreversible. We can't feel a pulse in the foot here, so we're using a Doppler tool to try and find blood flow, which is more sensitive than the fingertip.
But they can't find a pulse with the Doppler machine either. If Simon's going to save Brian's leg, he needs to try something else, quickly.
We're going to try and whack a Donway and see if it will bring it out to length better to improve it, and then get him into CT.
Yeah, manipulate it back.
OK, let's just get the Donway on.
This air-filled splint works by gradually pulling the fractured bones apart and realigning them. Simon's hoping this will help the blood flow back into Brian's foot.
OK, that feels pretty good. OK, lock it there then, please. It should be locked in place. OK, good. Right, let's just go for CT angio. OK, We'll CT his chest, abdo, pelvis on the mechanism. He hasn't got any head injury, but we'll do neck, chest, abdo, pelvis. Right.
Okay.
Right, we're going to get this guy into CT as quick as possible now, and the main thing we're doing is a CT angiogram to show the blood flow into his legs and see if there is any blood flow past the fracture.
They're ready for your scan.
Okay, we're going in. Yeah. Okay, we're going to take you around to CT, my friend, all right?
Okay.
It's now critical they find out whether or not there's enough blood flow to save Brian's foot.
We need to know the answer in the next few minutes. If it's not normal, we need to get him to the operating theatre. Here. So there's a fracture through his femur there. So fractures through his tibia and fibula here in his lower leg. Either one of those fractures is extremely painful. I wouldn't want to be going through what he was going through. But the most important thing about this is that the blood flow is actually good. As it comes down all the way down his leg, even past that femoral fracture, looks to be flowing all the way down there. He will keep his leg, which is obviously good. Hi, Brian.
Oh, yeah.
Let me just run through the injuries that we found. Firstly, your neck looks fine, so in a minute I'll be able to take this off your neck and at least you'll be able to move your neck. You've got a fracture of your shoulder blade, a fracture through your thigh bone, there's a fracture through the tibia and fibia, the lower leg bones, and there are also fractures in your ankle of the talus bone and the calcaneum, which is your heel bone, and the one above it which forms your ankle joint. We were quite worried about the blood flow into your leg past your femur fracture. We did an angiogram when you were in CT, and that actually shows good blood flow into your leg. You're going to need some surgery to your leg, obviously, to fix these various things, and some of that's going to be quite complicated, I think.
Sure.
But the immediate concern about the blood flow seems to be okay now.
Aisha is a 19-year-old female that's run out in front of a truck. Hello, sweetie. I'm just going to push on your chest. And she's hit the headlights with the right side of her pelvis, and she'll go to Royal London. Okay?
Hems are bringing in a 19-year-old female who's been hit by a truck. Vital signs are stable at the moment, but that could change, obviously. So have we got a new orthopedic surgeon? Have we put the trauma code out again? Hello. Okay.
Evening, guys. So this is Aisha. Aisha is a 19-year-old female that's run out in front of a truck. She's hit the truck, which was travelling about 30 to 35 miles an hour, with the right side, predominantly right pelvis. Injuries from top to toe. She's got abrasions to her face, but no fractured nose. She's got abrasions over the right side of her pelvis, and I'm concerned about a lateral compression fracture on that right side. She's got abrasions over both knees. Concerned a little bit for a patellar fracture on the right. Having said that, her knee appears to be stable and she's got good peripheral pulses.
Okay, thanks very much. You happy with the airway? So can you take control of the neck and we'll take the blocks and tape off?
With injuries that widespread, you're worried about everything else in between. There could be severe, life-threatening bleeding inside her chest, abdomen and pelvis occurring without obvious sign.
So we crack on with the primary survey.
Okay, no surgical emphysema, peripherally cold, good radial pulse. Abdomen is soft and non-tender. Pupils are 4 and equal, reactive to light. Do you know where you are at the moment? You are, okay. What year is it? What year it is? Okay, and squeeze my fingers. Okay, GCS of 15.
Okay. Okay, so can we get some more chest x-ray, pelvis x-ray, we'll do it fast. Concerned about the pelvic fracture. By examining, you can actually move the fracture and increase the bleeding. You're not going to tell exactly what type of fracture is by examining it, so you're better off not touching it, minimising movement, and get an x-ray as soon as you can.
X-ray. 4, 3, 2, 1. Okay.
Okay, well, so on first glance there's the pelvic ring, looks intact. Hello there. We've just done a couple of x-rays. The x-ray of your pelvis, actually, although they were worried about your pelvis, looks okay. But we're going to get a CT scan as well, because sometimes things aren't apparent on an X-ray. Obviously, you've been hit by a large vehicle and don't want to miss any significant injuries. So we're not going to let you move your neck until you've had the CT scan done, OK? Many people don't survive this sort of accident, but it seems to be very fortunate that she hasn't got any evidence of life-threatening injury. We've still got to go through the CT scanner to make sure there isn't anything that's less obvious than we already know. It'd be a mistake to relax. I think everything's fine at this point. Ready?
Are we doing this head and neck?
No, doing the whole lot. Mind your backs, please. Ready, brace, slide.
Am I going for the scan now?
This is the scanner, yeah.
We're just going to give you a little dye that shows up your vessels with this scan. It might make you feel like you wean yourself, you're not. It's just a sensation, pass away in like 30 seconds. I'm just letting you know, just in case you do have it. It's normal.
OK, I'm going to go through the other room now. See you in a few minutes.
Aisha looks quite well, but she's young, fit. Young people tolerate bleeding and hide it quite well. The CT will give us an answer as to whether there's any evidence of that, and the quicker it's done, the better.
The CT image is still coming through and being processed, so I'm just looking at pretty much the raw images. But from what I can see so far, I can't see any pelvic fracture, and I actually can't see any other major injuries. I haven't seen the CT of her head and neck yet.
The Royal London Hospital is home to some of the country's leading trauma specialists. Conducting on-the-spot investigations, they use all available clues to make critical, split-second decisions that just might save patients' lives. 19-year-old Aisha was hit by a truck whilst walking home from work. She's been in resus for just over an hour. Her scan results had initially seemed good.
Yeah, OK.
But more detailed analysis reveals a problem.
Thank you very much. Cheers, mate. Radiologist has just called me because they've been looking at those images. She's actually got a fracture of her neck.
It looks like a fracture of the uppermost bone in her neck. That's potentially a very serious injury. If it's unstable, then there's potential for her to have an injury to her spinal cord that could paralyse her, even prevent her from breathing.
He's still working on that nose.
I'm going to take this.
Well done. Excellent. Successful operation. So, Aisha, I just need to come and have a feel of your neck. Have you got any pain in your neck? OK, and no pins and needles or tingling or numbness in your arms? OK, and can you move your hands OK? Yeah. Can you squeeze my fingers tight here, and this one? And then open your fingers out, so just keep them straight. Don't let me bend them, keep them straight. Straighten them out. OK.
Just keep nice and still, Aisha.
OK. On the CT scan, there's an area in one of the bones of the neck, at the top of the neck, which looks like it's got a break in it. So that's why it's important to keep still at the moment. Any pain there? Try not to move your head, just say yes or no.
No. No. No. No. No. No.
OK, that's good. I'm going to do the collar back up for a minute. And just put the blocks back in. You haven't got any pain in your neck, and you're not very tender there. You've got no sign of any injury to your spinal cord. But actually, looking at this, it does look like a fracture, so that's why I'm being a bit cautious to keep you from moving, and we'll see what the chat to the neurosurgeons. OK? The neurosurgeons can't see her immediately. In the meantime, we're going to keep her collar on, keep her neck from moving, and she needs to have an MRI scan of her neck to look if there's any associated soft tissue injury. Fortunately, we found this fracture, because if we hadn't done that and she was allowed to move her neck, then that could actually render her paraplegic.
The trauma doctors deal with everything from life and death injuries on the road to medical mysteries in the hospital. And it's the elderly, with so many potentially serious health problems, that often prove the most challenging cases. An ambulance has just brought in the next case. Doris, an 83-year-old grandmother of 2, is confused and has been vomiting all night. Her son Stephen called the ambulance.
Hello, Doris.
Hello.
Hello. My name's Dr. Davies. I'm one of the duty emergency medicine consultants.
Oh, yeah.
You've obviously come in with the ambulance. What happened?
I had breakfast,
Yeah?
egg, all day.
Sorry, you had your breakfast,
Yeah.
and then what?
A bit of toast and I'll throw it all up.
And you started vomiting?
Yeah.
Oh, okay. Do you know where you are at the moment? Do you know which hospital this is?
In London.
Yeah, that's good. And do you know what date it is?
Oh, I'll forget the day.
All right. Do you know what time of day it is?
Gareth needs to get to the bottom of Doris's illness, but her confusion is making
Not sure.
his hunt for clues
Not
difficult.
sure. All right. Now tell me, you've got this vomiting. Have you got any pain anywhere?
No,
No pain?
I have got no pain.
Okay.
She can't even stand. She's so weak in the legs. There's no
Okay.
stand.
So did you pop around the house this morning?
I was on night work. I was doing 12 hours. I was absolutely knackered like no,
Well,
aren't
you must be.
So,
I'm sorry, I'm just trying to put all these bits in the jigsaw together to work out. Is she normally on the ball?
her memory's pretty good, yeah.
Yeah, but it's just down at the moment. In terms of Doris's past medical history, anything else? High blood pressure? No blood pressure.
Very low, not high, because
Okay.
she's anemic and it's low, very low.
All right, Doris, I just want to have a quick look at you and then we'll make some decisions about what to do with you, okay? Let's just feel your pulse here. Okay. Definitely not had any pains or aches. How have your legs been? Just weak? And just pop your tongue out for me. Gosh, you are dry, aren't you? Does that make you dizzy? In and out, that's good. She's tending to look to one side. She normally looks like that, does she?
She sits, watching the telly,
Okay.
she sits like one-sided, you know?
Okay, see that looks pretty pale. It looks as though you are anemic. Doris has vomiting, she's confused. Does this mean she's got a chest infection or a urinary infection? She looks to be looking to one side. Does she have problems moving that side of the body? Is it a stroke? Does this confusion and vomiting come from something such as a heart attack? Okay, we need to get some blood tests. We need to just see how bad this anemia is, and we need to get a heart tracing and a chest x-ray. But pop up a drip as well and we'll give you some fluids. All right?
Good.
Okay, all right. I'll be back shortly
Thank you.
and someone will come in and take these blood tests.
Thank you.
All right, okay. The medicine is very complex. Doris is absolutely in a class of her own. You know, if you had to answer a question in an exam about Doris, you could write for days on what it could be. There are literally hundreds of issues, diseases that can make you vomit, make you look pale, and make you confused. And actually what we've got to do is try and cut away through all the noise, work out which bits are really common in her age group and her sex, so that actually we start with a reasonable list. And we're going to chop away at the reasonable list, and if we don't get anywhere, we may go burrowing a bit further into the minutiae of medicine.
Gareth will have to wait and see if the tests he's ordered provide any fresh clues to Doris's illness.
We have just been alerted by the helicopter team that they're bringing us a cyclist who's got a head injury.
The fact the patient is coming in by helicopter gives Gareth a clue as to what he may be facing.
Any patient that the helicopter team come into the hospital with sets our alarm bells ringing really, because the helicopter only goes out to people who might have severe injuries. They're very rarely able to tell you exactly which part of them is painful. So we tend to use the clues from the scene to try and pick up any injuries that we think might be hidden and that you might not find otherwise.
Gareth will also be looking for clues about the head injury. Slurred speech, memory loss, or impaired vision could mean the patient has a bleed on the brain.
Good afternoon, ladies and gentlemen. This is Paul. He's a 45-year-old gentleman who's been knocked off his push bike by a van. He was GCS 13 at scene, but is GCS 15 now and has been seen to move all four limbs. Injuries head to toe. He has swelling of his right ear and behind his right ear, and he has a significant hematoma behind his right shoulder. He's extremely repetitive and has a marked retrograde and antegrade amnesia. He's had no drugs, he's had no volume issues, and he's been stable throughout.
Thanks very much. Okay, folks. So the first thing we're going to do is get Paul off the stretcher. So if we have a team on the left, bracing the patient, and this right blade of the scoop can come out first, okay?
Ready, brace, go.
Perfect. And then swap over.
His brain had a big impact, enough to knock him out. This big bruise behind Paul's right ear is right next to one of the blood vessels that runs inside the skull, next to the brain. I'm worried that in the impact, Paul's brain has been shaken. That big blood vessel might have been torn.
Head blocks and tape then, primary survey, and let's see some numbers when someone gets a minute as well.
The fact that Paul, a father of one, has memory loss is worrying. If he has got a bleed on the brain, it could kill him.
Okay, folks, given this repetitiveness, the head injury, the mechanism, we need to go to CT.
Any pain in your tummy, Paul? Abdomen is soft, non-tender.
Has he got any back pain?
Can you lift your legs up for me, sir? Forward.
Good.
And the right one?
That's all right, Paul, well done.
The account of the accident from the helicopter team
Good.
can provide vital clues.
He thought he was protected by the lorry and the car clipped him and knocked him off. That's what he dragged some distance.
Yeah. Okay.
He has been amnesic the whole time.
Interesting. The part of the history from the helicopter team that was very important was that they said that Paul was repetitive, repeating himself. If you have a big lump on your head with perhaps a skull fracture underneath, and if you're also repetitive and confused, that can mean that you've got about a 1 in 4 chance of having a bleed inside your brain. And interestingly, you wouldn't necessarily pick up the repetitiveness if you have one conversation with him. So it's the people who've been with him for half an hour, ask the same questions, perhaps get the same answer a few times, will be the ones that pick that up.
Capillary refill is good at 2 seconds.
Can you bend your knee for me?
So Paul, we'll get an X-ray of your shoulder. Yeah. Okay. Do you take any medication?
Yeah. Aspirin.
Yeah.
Okay.
So I've done an article history.
That's great, thank you. Sometimes in the trauma patient, if you are taking an aspirin, then that can thin the blood a little bit. So people who take aspirin, when they get severe head injury, they probably are more likely to have a nasty bleed inside the head. We need to go to CT. We'll look at everything, all right? Nothing we can't sort out.
The fact that Paul takes aspirin to help thin his blood is an added complication. If there's a bleed, time is critical. Paul's wife and daughter have been contacted and are on their way to the hospital.
I need to get this scan performed urgently. If there is any bleeding in Paul's brain, the best time to remove that would be now. If we find a clot here, we'll be going straight to the operating theatre.
While the helicopter team wait for their next call,
nobody would play my game.
they want to find out if Paul's going to be okay.
He's not right, is he? Definitely not right. Even
He's only just started to remember what...
He only got the day right once.
looks normal at the moment, but there are still some pictures to come back which will tell us whether there are any small bruises on the brain or anything like that. So good news so far. We don't need to rush off for an operation or anything. And we're still a little bit worried because Paul's still quite repetitive. He really didn't know what day it was all the way on his way to hospital. And so this could be a concussion, quite a serious concussion, but we need to make sure there are no little bruises on the brain, because those little bruises can get worse like any bruise can, and can change the course of Paul's progress through the hospital. So that's what we'll be doing next.
30 minutes later, and the full results are in. His wife Joanna and their 8-year-old daughter Sophie have arrived in time to hear the news.
Here we are, Paul. How are you doing?
Not too shabby, yeah. My shoulders.
Not too shabby. Your shoulder's a bit sore.
Very sore.
We've been through all the scans. Good news is, all we found is that little break in your shoulder. So we're going to keep you in overnight.
Okay.
Keep an eye on you. Make sure you don't misbehave. Do you remember what happened now?
I was going up a steep hill, coming up to a mini roundabout, but I don't remember anything else.
Yeah. And do you remember being in the ambulance or the helicopter?
I remember the air ambulance.
Yeah.
Yeah.
Okay. What was the Teddy's name again? Edward, that's right. I keep forgetting.
What did you get
so
Edward for?
I went to
to a hospital with bad stomach and I had to have a blood test, and I did so well. I got my teddy.
Excellent. I think all little girls who get blood tests should have teddy bears.
Where's my teddy?
You don't get teddy, you're too old.
Does that make you dizzy? She can't even stand, she's so weak in the legs. You've got this vomiting, have you got any pain anywhere?
No.
There are literally hundreds of issues, diseases that can make you vomit, make you look pale, and make you confused.
Gareth is still trying to get to the bottom of what's making Doris so ill. But his hunt for answers has taken another direction.
As is often the case, Doris's presentation is becoming slightly more complex as you start to discover more about her. We now know from looking at her old medical records, she does have multiple medical problems. She has mild kidney failure. She's also had problems with her thyroid. So there is a quite complex background of issues that could cause the symptoms that she presented with.
Does that feel all right, Doris? No funny feelings up your arm?
No.
No.
But she had those abnormalities a week ago, which tells us quite clearly and simply something else has started, something new has happened. That's the bit that we're trying to discover at the moment.
The first lot of test results offer Gareth a new lead.
Her blood tests show very high calcium level in her blood, and her white count is raised that suggests she's got infection, all of which could account for her confusion.
Gareth needs to confirm that an infection is causing her confusion and vomiting.
That's fine.
He starts with a chest x-ray.
Okay, now we just need to put a cold, hard board behind your back, my love. Just come forward again. Be cold and hard. It's only there for a minute, okay?
Right. Yeah.
Good. Just try and sit nice and straight, nice and still for me. Good. Doris, take a big breath in. And breathe normally. You're done already, my love.
So this is Doris's x-ray, and you can see at the border of the heart on the left lung field, there's a little bit of shadowing, and that to us is an indication that there may be a patch of infection there. And that infection is enough to make her confused, it's enough to make her start vomiting, and it's enough to make her dehydrated. As well as Doris's chest x-ray, a urine test has now come back and suggests that she's got a urinary tract infection. So now she's in a position where we think she has two sources of infection, and she's now receiving intravenous antibiotics to fight those.
But Gareth's still not convinced the infections are the only cause of Doris's health problems.
Doris isn't out of the woods completely. Her calcium levels are high. There's still another layer of work to be done to work out why the calcium was so high.
Aisha is a 19-year-old female that's run out in front of the truck.
One of the bones of the neck, it looks like it's got a break in it. That's why it's important to keep still at the moment. And that could actually render her paraplegic. She needs to have an MRI scan.
Aisha had an MRI scan the following day. Simon has the results.
The area we were worried about was on the right-hand side here. What you can't see on the CT scan, what you can see very clearly here is a spinal cord. If there was any fracture or any swelling, you would see it pressing against the spinal cord. The bones look absolutely fine there.
What they thought was a fracture was actually just the unusual but harmless way her bone had grown.
We obviously had to treat her cautiously as if there was a fracture until we were certain. But the good news is that the MRI scan didn't show any fracture, and so she's been able to get up, walk about and go home.
I was scared. They said that I need to keep my neck still, and it was really hard for me to sleep that one night with the collar on. But they came in the morning and they did tell me that nothing was really wrong with the neck. So I was actually relieved, you know, them taking the collar off me. So yeah. My mum had tears in her eyes and I was like, Mum, don't worry. I was actually, to be honest, I was scared. Because that was my first accident. I was scared that I would die. But thank God he helped me. believe in my God, so yeah.
This gentleman's name is Brian. He came off his motorbike at a corner and hit his leg on a telephone box.
He will keep his leg. You're going to need some surgery, and some of that's going to be quite complicated, I think.
Brian ended up having an operation to insert metal rods in his thigh bone and lower leg, and has 9 pins holding his heel bone in place.
It's quite painful, but at the moment I can get around on crutches, I can get up and down the stairs. It takes me a while to get up. Coming down's easier. It's quite a scary place to be when you're on your back and you've got no control. But luckily I had obviously people that knew what they're doing and brilliant at their job, and obviously I trusted them, and I've come out through the other side, sort of, well, not unscathed, but alive and well, and got me foot and my leg. Definitely planning on getting on the bike, get back on that horse as soon as you can. I do know other people who are married and got kids, and their wives won't let them get back on the bike again. So, but I haven't really got that scenario, unless my girlfriend puts her foot down.
You've got this vomiting. Have you got any pain anywhere? A blood test showed very high calcium level. I think she has 2 sources of infection. There's still another layer of work to be done.
That one's from my grandson.
It's 5.5 weeks since Doris was rushed to the hospital. She's been treated for her infections and is now no longer vomiting or feeling confused.
Nice colour there, hasn't she? Yeah.
Do look well.
She's going home tomorrow, and she can't wait.
Bacon tomorrow, eggs, and 2 fillet steaks.
And the doctors have solved the final piece of the puzzle. But sadly, it isn't good news.
One of the tests that we did when she first came in, the calcium levels, have been followed up by the doctors on the ward. And as they've chased the origins of that high calcium, Doris has unfortunately been given a diagnosis of breast cancer. High calcium levels are quite a rare complication of cancers, and usually a sign that the cancer has spread from its origin to some of the bones in the body. And as they rise, they cause confusion, vomiting, and dehydration. So in many ways, Doris's original presentation had lots of layers in it. She did have an infection that made her confused and dehydrated and unwell, but actually underneath all of that was a much more difficult diagnosis. There's no doubt that cancer would have continued to get worse and worse, and undiagnosed would kill her. As it is, she's now on the right treatments for breast cancer, which hopefully will extend her life and extend the quality of her life.